I call this conversation the red flags, the conditions that should serve as red flags that you should consider that you have small intestinal bacterial overgrowth. Well, what is that? Well, that's a very severe form of dysbiosis. Now, I discuss very thoroughly all the factors in dysbiosis in my Undoctored book, Undoctored: Why Healthcare Has Failed You and How You Can Become Smarter Than Your Doctor. But this is a conversation that goes even further. Now, this video also supplements another video that I've recently made called The Telltale Signs of Small Intestinal Bacterial Overgrowth, the signs that you should look for in yourself, in your abdominal symptoms, in the toilet, and some other phenomena that can tell you whether you might have it or not. But these are the conditions that suggest you have it. Now recall that small intestinal bacterial overgrowth means that the disrupted bowel organisms that are supposed to be confined to your colon have ascended up through the 24 or so feet of your small intestine and up to the duodenum and even to the stomach. In other words, your entire gastrointestinal tract is infected with these unwanted organisms. Organisms should be in the colon, but not any higher than that. But in small intestinal bacterial overgrowth, they've ascended all the way up, or most of the way up, and can be responsible for a multitude of symptoms and health problems. Some of them intestinal, many of them outside of the intestine, like skin rashes and emotional changes and joint pains and many, many other health problems. And specific efforts to correct it need to be pursued. So what conditions, if you have them, should cause you to very seriously consider that you have small intestinal bacterial overgrowth? First is fibromyalgia. There was a recent study that showed that of the people who had fibromyalgia, 100%, each and every one, had small intestinal bacterial overgrowth, and they had it quite bad. So efforts to identify and correct small intestinal bacterial overgrowth need to be pursued. Irritable bowel syndrome, or IBS, is commonly associated with small intestinal bacterial overgrowth. As many as 84% of people will have this added condition, and that needs to be addressed. Rosacea, very commonly associated with small intestinal bacterial overgrowth, which must therefore be addressed if you want to be fully freed of the inflammation and rash of rosacea. Restless leg syndrome is a kind of a wacky expression of small intestinal bacterial overgrowth, but unless you address the small intestinal bacterial overgrowth, you may not have full relief from that process that disrupts your sleep and the sleep phases. Fatty liver. Fatty liver does respond very well to the basic undoctored efforts, but you may need to pursue this additional diagnosis to get full relief and full recovery of your liver and protection from cirrhosis. And inflammatory bowel disorders like ulcerative colitis, Crohn's disease, and celiac disease are also commonly associated with intestinal bacterial overgrowth, and that should be pursued so that you can get full relief of the inflammation, the diarrhea, the risk for cancer, etc. Now, some people will respond to the basic wild, naked, unwashed efforts of the Undoctored program. That is the removal of wheat and grains and sugars, restoration of vitamin D, iodine, magnesium, fish oil, and the bowel flora cultivating efforts like a high potency probiotic and then the prebiotic fibers. Some people get by with just that. Most don't, though, if they have this small intestinal bacterial overgrowth. One signal that suggests you might have small intestinal bacterial overgrowth is if you have excessive gas, bloating, and diarrhea from the introduction of the prebiotic fibers. Now, we often tell people in the Undoctored program, if that happens to you, stop the prebiotic, continue everything else, including the high-potency probiotic, for another 4 weeks, and then you can reattempt introduction of the prebiotic fibers. If you feel fine, you may have taken care of the small intestinal bacterial overgrowth with those initial efforts. If the abdominal discomfort, diarrhea, and bloating recur, then stop the prebiotic fiber once again. You can continue the probiotic, and you can try that process again another 4 weeks later. But you should start thinking about whether you have small intestinal bacterial overgrowth that may not ever respond to just those initial efforts, and you may have to pursue that further. This is all detailed extensively in the Undoctored Inner Circle, including a full Undoctored protocol that shows you how to recognize it, what steps to take to document it, and what steps to take to get rid of it over time. So, bottom line, this condition that we all have underestimated is actually quite a bit more prevalent, common than we thought. But if you take the steps to recognize and then correct it, that may be the key to full recovery of health. And it's an effort. It's a little bit complicated, more complicated than most undoctored pathways, but it's a very important one and something you do have a lot of control over.